Hi, my name is Carly Nelson, and this is my presentation for peritonitis prevention for peritoneal dialysis patients. So, a few of the things we're going to talk about today. One is why we chose peritoneal dialysis. Another is what is peritonitis, what causes peritonitis, and why does peritonitis matter. We're also going to learn what we can do to prevent peritonitis, and then we'll review what we've learned. So the goal of today is we want to learn about peritonitis as a whole. Many of you are probably seasoned PD patients and maybe thinking, why do we have to keep learning this? Well, we're going to learn that about peritonitis as a whole, and we're also going to learn why it matters and what we can do about it. So again, like I said, you might be thinking, I've been on peritoneal dialysis for 6 years. Why does this matter? Just going to review because research shows that the more that we retrain, the better our outcomes are. So dialysis is renal replacement therapy. So you could be on dialysis for a number of reasons, and probably among us, you're on dialysis for different reasons. But ultimately, you're on dialysis because your kidneys aren't functioning the way they're supposed to. And our kidneys filter out excess waste and fluids from our body. So there's two main modalities for dialysis. We have hemodialysis and peritoneal dialysis. So hemodialysis, I'm sure you know some about it. Maybe you've even been on hemodialysis before. But hemodialysis is when these waste products are removed through your blood. So that's either going to be through a fistula or a graft in your arm or through a permacath or vascath, which is basically like a big IV. So hemodialysis is done in a clinic. Typically, people who are on hemodialysis will go to the clinic 3 times a week for about 3 hours at a time. So if you work or you have kids, that might not be the best option for you. Peritoneal dialysis is done at home by you, and I'm sure you all know this. As peritoneal dialysis patients, you're probably all on different modalities of peritoneal dialysis. So with peritoneal dialysis, or PD, you could be on continuous ambulatory peritoneal dialysis where you're doing exchanges every 4 or 6 hours, or you could be on your cycler at night. And there's a lot of different options and little modifications that you have with peritoneal dialysis. So why did you choose PD? When you were first told you needed to go on dialysis, likely you were given options, and that's how you found yourself on peritoneal dialysis. So oftentimes people report that they chose peritoneal dialysis for their independence. So I've had patients who say they choose peritoneal dialysis because it allows them to work and doesn't limit the days that they can work because they don't have to go to a clinic either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, which can greatly impact the hours you're available to work. Independence, you're performing it yourself. Sometimes you might be assisted, but you're not reliant on clinic staff to do your dialysis. Cost, research has shown that peritoneal dialysis is actually a more cost-effective method, and time. Not only are you at the clinic and that can affect your work with hemodialysis, but you also have other things in your life. Maybe you have kids, maybe you have family members you're caring for, and you can't give up 3 hours of your day 3 times a week or more. There's a lot of really great benefits to PD, and I'm sure we all have our own reasons why you might have chosen them. But there are some things we have to be concerned about. So with PD, it's not a magic alternative to hemodialysis. So one of the major concerns with peritoneal dialysis is peritonitis. Peritonitis is an infection of the peritoneum. That peritoneum is the lining inside your abdomen. And it's a membranous lining, and it allows solutes such as sodium, your urea, and fluids to go in and out. Those are those things that we're trying to filter out that your kidneys aren't able to do for you anymore. So when that becomes infected, that's when we have peritonitis. It's a very painful infection of that lining. It may cause you to be hospitalized for treatment, it might not. So some of the major causes of peritonitis are exit site infections. Two of the main microorganisms that cause exit site infections are Staphylococcus aureus, which is a bacteria that's normally colonized on your skin, right? It's normally there on purpose and it doesn't do any harm. But when you have an opening to the inside of your body, which you do with your dialysis catheter, and it gets inside, then it can be problematic. So exit site infections, or an infection of the skin around your catheter, can cause peritonitis. Hand hygiene. We're supposed to be using good hand hygiene when we do our peritoneal dialysis. So washing our hands, scrubbing under the fingernails up to the wrists for 2 minutes or more. So if you're not practicing good hand hygiene, that can lead to introduction of bacteria into your dialysis catheter on the end, or again, exit site infection around it. The environment, if you are in an unclean environment, so you don't want any drafts when you're doing your dialysis, you don't want pets around, you don't want other people. If you do have to have someone there to assist you, you want to make sure that you and them are both wearing masks, because you don't want any chance of bacteria or anything else getting into that catheter. And I reviewed the bacteria already. So treatment for peritonitis. The good news is you chose PD because you didn't want to be in a clinic. You wanted to be in your home. The good news is typically we can treat peritonitis with intraperitoneal antibiotics. Good news, right? Because you can do that at home. You'd probably have to go to your doctor first, but with proper training, it's just like you were doing any other peritoneal dialysis exchange, except they give you a bag that has antibiotics in it, and it'll kill the bacteria. However, sometimes that's not adequate enough, and you may have to be hospitalized and receive IV antibiotics. So we want to avoid being in the hospital. It's expensive, you've got stuff to do, so we want to avoid peritonitis, and we'll talk about how we can do that in a minute. So why does peritonitis matter? In addition to avoiding hospitalization, it is the leading cause of PD failure. And when I say peritoneal dialysis failure or technique failure, what that means is typically researchers will define that as a switch to hemodialysis. So we talked before about the things that matter to us, why we chose peritoneal dialysis. Peritonitis is the leading cause of failure of PD, and if you want to maintain your ability to stay on PD, you want to avoid peritonitis. So some of the things we can do to prevent peritonitis. Technique. One of the things that can cause peritonitis is wet exposure. So that's if, hypothetically, let's say you are going about your day, whatever, you do your exchange, you drain, you fill, you dwell, and you unclip yourself from your bag, and then you don't put a cap on, and your catheter is uncapped for an extended period of time. You're going about your day, you're sweating, you're washing your hands, you're in a public bathroom. All of that is exposing your catheter to unnecessary bacteria. So then you've been uncapped, 4 or 6 hours go by, however long your doctor has prescribed for you for your exchanges, and then you go to hook yourself back up to do another exchange. All that bacteria that was in there is now able to access your peritoneum and potentially cause peritonitis. We don't want that. So always making sure that you're only uncapping and unclamping your catheter when you're ready to connect for your treatment. Another thing we have to worry about, hand hygiene. So the American Association of Kidney Patients says we should be washing our hands before each exchange for at least 2 minutes. So what we mean by that, you don't have to set a timer. You just want to sing happy birthday probably at least 3 times. You're scrubbing under hot water and with hot water and soap, scrubbing under your fingernails, past your wrists for 2 minutes before you do every exchange. So if you're doing manual exchanges every few hours, before every exchange. If you're hooking up to a cycler at night, do it after you brush your teeth, then hook onto your cycler and you're good to go. Site care. So the International Society of Peritoneal Dialysis recommends the use of an antibiotic ointment around your site daily. So ultimately, that's going to be up to your nephrologist what that is. They recommend mupirocin and gentamicin. And the reason for that is because those are effective against 2 of the most common bacteria that can cause peritonitis. Other than the antibiotic ointment, the other thing you can do is just keep it clean. So there's no real difference that they've found between washing with soap or water or washing with antibacterials, but you want to keep it clean. So you're washing the site daily, you're applying your ointment daily. If you want to put a dressing on there or coil your catheter when it's not in use, that's okay too. So we're going to do a quick knowledge check to end our presentation, but first I just want to finish by saying, no matter how long you've been on PD, keep going to your follow-up appointments, keep seeing your nephrologist, and keep getting trainings and going to trainings. They recommend at least once a year because we get used to what we're doing on the day-to-day basis, and you might be losing the technique that's recommended and might not even realize or remember. So by going to frequent retraining, if you have home care nurses or a clinic you can go to, it will decrease your rate of peritonitis and keep you from switching to hemodialysis, which is probably a goal if you chose peritoneal dialysis in the first place. So we're going to go over some questions. What is peritonitis? Is it A, an infection of the kidney, B, swelling in the kidney, C, pain in the belly, or D, infection of the inner abdomen lining? And the answer is D, infection of inner abdomen lining. All right, true or false? Hand hygiene can help prevent peritonitis. That's true. And then what is technique failure? When the dialysis cycler alarms, a switch to hemodialysis, peritonitis, when the effluent is cloudy. So the answer is switching to hemodialysis. So ultimately, that is technique failure. Peritonitis can lead to technique failure, and cloudy effluent can indicate peritonitis, but the term technique failure refers to switching to hemodialysis. These are my references. Thanks for your time, everyone.